Welcome to Raaonline. I am Dr. Venkatekrishnan. We will discuss deep tendon reflexes. For a UG level, one of the important examine question, and we should know what to examine, what are the reflexes to be dealt in detail, what is the significance of DTR, what is upper motor neuron, lower motor neuron, what happens to DTR. So, any reflex reaction requires a stimulus, a sensory pathway, there is a motor unit, motor neuron and an effector contractile structure. Any breach in the system is a stimulus or a sensory pathway, a motor pathway, motor neuron or the muscle. Any breach in the system results in a absent reflex. Higher centers also influence this reflex arc, and when there is a breach of these pathways, higher centers, the reflexes are fundamentally changed. We have to check whether the reflex is present or absent, whether it is exaggerated also, normal or showing signs that influences from higher center are defective, that is exaggerated deep tendon reflexes. Is absent, if it is absent, you have to look for there is a motor involvement or a sensory involvement. The abnormalities can be unilateral, bilateral. The definite level can be detected in the nervous system. DTR, we have a reflex arc and the root involvement, which will say what is the level of biceps gel. One of the easiest to demonstrate, you have a specific technique, we will go to the technique. You keep your index finger over the biceps tendon and strike with a knee hammer. Often asked, what do you look for, flexion or extension? That is usual question from the examiner. Immediate answer will be flexion. It is not the flexion. You have to look for flexion, agreed. But you have to look primarily the contraction of biceps muscle. Contraction has to be looked. So, normal result is flexion of the elbow and visible contraction of the biceps muscle. The segmental innervation is C5 and C6. The peripheral nerve is musculocutaneous nerve. So, it can be absent when there is a problem with the musculocutaneous nerve, neuropathy, or muscle is affected, biceps muscle. It can be exaggerated when the higher control is, that is, you get in a pyramidal lesion.